Let's talk today about relationships. So, if you have your tidy mind map and you're using your journal or whatever you use to dissect your mind to be able to see what's going on in there, I'd like you to go to the people room and I want you to make a list of all the players in there, all the people that you are in the closest relationships with, like that you see every day or that you may talk to more frequently than other people. This could be people in your family, people that live in the same house with you. If you live alone, it could be your kids or anyone who you interact with. I want you to label all the characters in your people room, who your mind talks about, who your mind worries about, who your mind gets upset with or angry with. Write those down. And then I want you to, for the purpose of, as you're listening to this talk, I want you to pick the person who you have the most difficult relationship with, meaning you butt heads a lot, you just seem like you can't communicate, you say things and it's taken the wrong way, or they say things and you take it the wrong way, or maybe you feel they're abusive, maybe whatever it is, I want you to pick that person. And we're going to apply what we're talking to you about to that relationship, because we want to learn how to improve our relationships, not only improving our own internal relationship, but improving those relationships that are outside of us. So on level 1, let's say we're playing a game here and there's difficulty levels. Level 1, there's the relationship with yourself, and that's where we're all starting, is to just see the relationship that you have with your inner voice or with your DJ Judge. What is it saying to you? How does it talk to you? Is it abusive? Does it create problems for you all the time? Is it constantly making messes and dramas where there shouldn't be messes and dramas? What is it doing? And we're learning how to interact with that voice. Now, a lot of you want to, I'm learning, and I did this too in the beginning, you want to shut that voice up. You want to shut it down. You want to push it away. You want to ignore it. You just want to make it stop. Now, something that's important here is I don't want you to, we're not going to make this voice stop. And we're not going to make it stop by arguing with it, by trying to convince it of something, by trying to prove it wrong, by trying to talk it out of whatever it is saying. This is an insane voice. This is a crazy voice that is talking to you, and you're not going to convince it. You're not going to make it think something else. You're not going to change its mind. You're not going to make it better by what you are saying back to it. You're not going to have a conversation, a word-on-word match with this thing inside your head and make it stop. Okay? And I know a lot of you are doing that, and a lot of you are trying to talk sense into it, trying to convince it, and you're wasting your breath. Okay, so just go ahead, give it up. So, Angie, what do we do then? If we're not going to talk sense into it, how do we change this? Well, what we do on the inside of us also goes for what we're going to do on the outside of us in those outer relationships. You can never force a behavior change. You're never going to convince a mind that's in that mode of insanity, that crazy that crazy mind. You're not going to talk sense into it. I used to work in a psychiatric unit, and I worked with people who were pretty severely, they had schizophrenia and had hallucinations, visual, auditory hallucinations. It was pretty severe type of bipolar mental disorders, like pretty severe mental disorders. And you learn really quick. There's no way you're going to stand there and talk to that person and explain to them that they're not seeing what they're seeing, or they're not experiencing what they're experiencing. It is very, very real to that person. So you're not going to use logic and common sense and explaining and teaching and helping them see and helping them understand. Doesn't apply. Same for that voice inside your head when it is in that crazy state. You're not going to convince it of anything. What you do is you go with it. Just like you would a person. If you were working in the psychiatric unit like I did, if somebody says they're afraid because they're seeing a man in the corner, you help them feel safe. You say, well, you don't argue with them and say, there is no man in the corner. Get over it. Stop thinking that. Stop feeling it. No. You say, come here. Let's get to a place where you feel more safe. Do you feel more safe right here? Can you still see him? And if they said yes, you would move to a different spot. Okay, are you feeling more safe now? So you're going with whatever it is they're believing instead of trying to convince them otherwise. This is how you are interacting with DJ Judge. Okay, in your head, that voice is convinced of what it is seeing and feeling as being extremely real. And now, if you believe it also, if you're really engaged with that DJ Judge, you're feeling it, your emotional body is also involved. That's a sign that you've lost some awareness. You've lost some. It's kind of taken you over again. You're embodied inside that DJ Judge when your emotional body is now reacting as if whatever it is saying is real. So that's kind of a little clue for you. If you're already feeling the feeling, you're already in there. But it's okay, because when you feel the feeling, you'll be like, okay, well, I've gotten sucked into this crazy. And it's okay, the feeling's already there. I'm not going to deny I feel it. And I'm going to say to myself, separate. I'm going to use that keyword, separate. Step outside of what that mind is saying. Listen to it say, oh, well, this is happening, and now this is going to happen, and now they're going to think this, and it's very, very real. It's very, very convincing to this voice in your head is very convincing that all these things that it's saying is going to happen and it's fearing it are real and are actually going to happen. So you separate yourself and say, okay, well, I'm not going to argue with you. I'm not going to try to shut you down. I'm not going to beat myself up because I'm now feeling an emotion in my body. I'm going to listen to you, and I'm going to help you feel more safe. You're going to help DJ Judge come to a more safe place, just like you would that person who's having those hallucinations in the psychiatric unit. You're going to help that voice come to a safer place. I understand this is what you are saying to me right now. I understand that this is a big fear that you have. I understand that now you have my emotional body all stirred up about it. I understand that now I have an energy running in my body that I'm going to have to release now, whether that's through tears, through screaming, through jumping up and down, through throwing something. Don't hurt anybody, but through whatever the release is. I understand, like, now you've stirred everything up, so we're going to have to get the energy out. I understand all of that. How can I make you, not me, it's not you that's not feeling safe, it's this voice of the mind. It's DJ Judge that is not feeling safe. How can I make you feel more safe right now? What is it that you need? This is how you're learning how to meet yourself with compassion. Meet yourself with kindness. Meet yourself with understanding. A lot of us, when we first start trying this, we don't meet that fear with kindness and patience and understanding. We meet any fear that comes up or that our mind brings up to us with, stop that. Just go away. Just stop saying that. I'm not listening to that. I put my fingers in my ears like I'm not listening. Oh, I'm not listening to you. Like that's what we try to do. We try to shut it up and distract ourselves and pull out our positive affirmations, and that would be the same as if you were working in that psychiatric unit and somebody's over here they're escalating, having an episode, and now you're standing in the corner with your fingers in your ears saying, I'm not hearing this. No, no, no. This isn't happening right now. Nope, nope, nope. It is happening right now. Like you're now acting as crazy as the person who's having the hallucinations. It's like, it's happening. It is happening. Admit it. It's happening. Now, you're trying to ignore it or shove it down or avoid it because you're beginning to understand that it stirs up your emotions when you think you are allowing this to happen. You're not allowing anything to happen. It's just happening. There's no choice in it. Like you're not saying, okay, I can allow this or I cannot allow this. It's happening. Same with the person in the psychiatric hospital who's having the hallucinations. It's like, it's happening. I didn't choose, okay, well, should I let them have the hallucination or should I not? No, there was no choice. There's something inside of you that was an stored emotion or wound that was poked or triggered or whatever happened. Your mind freaked out about it. It started having its hallucinations, and you can stand in the corner and argue with it and pretend it's not happening and ignore it and avoid it, and now your emotions are all stirred up and now you're not releasing those either. Nope, don't feel that, don't feel that. No, all I am peace. I am peace and joy. That's all that I am. No, you're not. No, you're not. Your body is not at peace. You're in denial. It's not peace. This is happening. And it's okay. It's okay that it's happening. If you can have your awareness, then you can handle it. You can handle it as it's happening. That's all that you need, is just to know that you're not that patient that's having the hallucination. You are the medical health provider. You're the professional here that says, I see your fear. I see what you're seeing. I see what you're feeling. Feels so real to you. I see the fear. I see what you're afraid of. And I'm really, really sorry. I'm sorry that you're feeling this or that. How can I make you more safe? That dialogue right there, admitting it, embracing it, working with it, how can I make you feel more safe? That is going to create the peaceful relationship inside of you, because each and every time you meet that DJ judge as a patient in your head and say, come here, I see you are scared about this or that. How can I help you relax about it? I know you're confused. I can see your confusion. I see you're spinning out of control. I see you're overwhelmed. I see you're desperate. I see you're so upset right now. I see the fear is overtaking you. I see you're anxious. I see you're depressed. I see it. And I'm sorry. How can I help you? How can I make you feel more safe? What would make you feel better right now? And then to be able to work with that in a way that you are not identifying with that creator of the pain. You are standing in a calm, separate place, watching this entity spin out of control, the entity that you've thought, this little being in your head that you've identified with for so long, and you suffered and you had the pain and you had the anxiety, you didn't know what to do. You were the patient. You were the one needing someone else outside of you to make you feel safe. Now you're separating, you're getting some power, you're getting some ability to be able to calm yourself, to be able to work with yourself, to be that thing you're looking to everybody else to be for you. You are providing that safety. You're not looking outside of you for your spouse or your kids or your job or your whatever to provide safety. You are the safe place, because now you are that mental health care provider. You are the one that knows the place, that knows the way to peace, that knows the way to help this part of you relax, that helps talk it off the ledge. You are that professional. So you are becoming that. You're becoming that for yourself. And now, when you're in relationship with other people and you see this happening outside of you, you're getting very good at doing this for your own mind. But now, when you're in a difficult relationship, what you're dealing with is not that person's true essence. If there's a conflict ever, that is two minds. That is two DJ judges, both scared of something, interacting with each other. That is two mental patients having a go at each other. That is what that is. That is not two healthcare providers. That's not two professionals going at each other, because they don't operate in that drama. They don't operate in fear. They know everything's okay. They're in their sanity. They're in the peace. They know they're safe. If there's conflict, if you're in a conflict with another person, when their mental patient comes out to play and is speaking to you and maybe blaming, and the fear is so real that they're attacking and they're shaming and blaming and trying to manipulate with their words, you have a choice in that moment that your mental patient can come out and start interacting with theirs. So now you're just two crazy people interacting with each other. Or you can stay and in your space of sanity and be able to just see their fear. This isn't personal. This isn't about you. This is something going on inside of them, making them speak these words out to you. This isn't even about you. This is something going on in them, and they need to feel safe right now and don't know how. They don't know how to give it to themselves, just like you didn't used to know how to give it to yourself, but now you're learning. So now you have the opportunity to provide that safe space for them and say, I understand you're upset right now. I know this is scary. I know maybe you're even afraid of something. How can I help? What can I do? Now, if you're in there taking things personally, getting offended, having your own mental patient poked, and your own fears start coming up, neither one of you are going to be a safe space. Nobody is providing a safe space for anybody, and it's going to end in an explosion with one person slamming a door or walking out. That's just, there's no adult there. There's no adult present. There's no mental health care professional present to help in this situation. So I want you to know I don't expect you to never ever have another argument ever again. I know that the pull of the mind and that fear can overtake you, and it's okay. But what we're doing in this process is making those moments less and less and less until you notice that your relationships are becoming more peaceful and you're not interacting with them from your mind with your DJ judge. You are now holding a safe space for everyone in your life to come to you, and they can be as crazy as they like in your safe space, and you always hold the same feeling. You never judge them for for being sick. You never criticize them for what comes out of their mouth when they're in fear. You never make them feel guilty or shame them or try to manipulate or change their behavior. You never do any of that. You just are unconditionally the same because you're living in your heart space, and you become that unconditional love and that acceptance to that person. So I hope this has helped. That's enough for now. That's enough to soak in. So it starts with you. It starts being able to do that for the voice in your own head to provide that safe space, and then you'll be able to do that for everyone around you in your people room, in your relationship room, and you will provide that unconditional love and acceptance not only for yourself but for everyone else.